A patient is showing signs of verbal and nonverbal cues of anxiety, meaning that verbal would be them stating it, and then nonverbal, you could see it on their face or they're showing it in other ways. And this is happening while they're waiting for a procedure. What is the most appropriate response from the medical assistant? So remember, when you see most, that means that there might be other options that are somewhat helpful or maybe helpful eventually, but most, we're looking for the best choice. And sometimes if you get a little mixed up with the most type of questions, just think which would be the first step. So whatever you would do first in this scenario would be help lead you toward what would be the most or the best option. So looking at option A, it says briefly explain the procedure again and assure the patient that everything will be fine. And the reason that this would be incorrect is for two reasons. Briefly explaining the procedure again, maybe that would be useful, but you don't know if the patient is feeling anxious because they don't understand. They might just be worried about the procedure. And then assuring the patient that everything will be fine, that's not something that you would want to tell the patient because you're making a promise that you might not be able to keep. You don't know if everything will be fine. So that's something that you'd also want to avoid. So let's extend option A, and let's look at the next choices. So option B says, offer the patient a stress ball to squeeze, and then suggest some deep breathing exercises. So now this is an example of what we mean when we say we're looking for the most appropriate. And usually the most would be step 1, and then something else that could still be appropriate would be later down the line, step 2, step 3. So something like this in option B, offering the stress ball, suggesting deep breathing exercises, that's something that maybe would be helpful later. First, we want to actually acknowledge and address the anxiety they're feeling, because if you just note that the patient seems stressed, seems anxious, here's a stress ball, it might seem a little bit like you're not actually discussing what it is that they're concerned about, and that maybe it's something that we could actually fix more concretely if we know exactly what it is that they're stressed about. So let's eliminate option B. There's probably a better choice here. Option C says, excuse yourself to get vitals and minimize interaction with the patient. So it sounds like you'd be leaving this patient and maybe coming back, and that wouldn't be doing much to address the situation or help the patient feel better here, because you're just acting like nothing's going on, and then their needs aren't being addressed and cared for. So let's eliminate option C now. And now taking a look at option D, it says to acknowledge the patient's anxiety. Acknowledge is always a good step to take. So we're acknowledging it, validating their feelings, and offering support. So the offering support could maybe be back to step B, if maybe something like that is helpful for the patient. But first we want to acknowledge and validate so we can find out more information on what's bothering them, because maybe there's a better solution depending on what it is that they're feeling anxious about. So option D encompasses all of that, so that would be a good choice to answer this question.